Good morning. It's the morning, right? Yeah. This is working? Great. So I'm so excited to be here today. As I was walking in here today, I kind of became jealous, actually, because when I went to hospitality management school after I recovered from being a chef, I did not have a beautiful campus like this. It looked nothing like this, actually. So I was thinking back and like, oh, would I love to be a student again, actually, and go to a program like this here. So I'm in healthcare now. I've been in healthcare for the past 15 years, but the hospitality, I guess, never leaves you. It's always in you. Being a chef is always in you. And I'm going to share with you how we have approached changing hospital food within our organization. We haven't found, I'm going to use a food pun also, we haven't found the secret sauce, but this is certainly what we have done. It works for us. My hope is that food overall in the healthcare industry improves, and that's why I'm excited about sharing with you here today. So Northwell, yeah, we are the largest healthcare provider in the state of New York. A few numbers here I want to point out. One is that we have 21 hospitals. It's all those blue H's on the map, from Staten Island to all the way as far as you can go on Long Island, and then up into northern Westchester. But we also have a massive ambulatory network. So it's actually, we have like 900 ambulatory locations. But now today's conversation obviously is about food, and where we serve food is in our acute care hospitals. We also have 84,000 employees. So we are impacting our entire employee population. And then if you extrapolate that out to families, et cetera, it's reaching a lot of lives within our organization. I'm the Chief Experience Officer. Foodservice was not of my job description when Michael Dowling, our CEO, hired me 9 years ago. But we have a patient experience strategy that focuses on the expressed and unexpressed needs of others, the culture of our organization, the care delivery processes, where we talk about designing human-centered care experiences. We focus on hospitality, creating a welcoming and healing-focused environment and services, and all that through a structure of accountability and responsibility and ownership. And as I look at that, I think the food we serve fits into every single one of these buckets, and we'll talk a little bit more about that. When we started, we really started from the standpoint of listening to the voice of the customer. And that's my number one job responsibility, is listen to the voice of the patients and then act on it. And what we heard from our patients about the food was not great. It was horrible, actually. Now, mind you, the standard in healthcare is pretty low, right? We can agree on that. Hospital food does not have a good reputation. Maybe one up from prison food, but that's also not a very high bar. But when we started to dive into that, our CEO, Michael Dowling, started to get really frustrated because he had a stack of complaint letters on his desk. And we also saw it through the feedback we received on our patient surveys. And as we dug into it, we were horrified, because what our patients were saying was just awful. They said the food was inedible most days. They said that the food was atrocious. Think about the words that they've chosen, right? Atrocious and unpalatable, not fit to feed my dog. Or hire a nutritionist. Well, we had them. Food was too heavy on carbs, sauces, waterlogged, frozen vegetables, and sugars. And those are representative comments. We heard this stuff over and over again. Hire some chefs who know how to cook. We took that very seriously, and we talk about that in a minute. Every meal brought to me was unappetizing. People need good food to get better. And that, I put myself in the shoes of the patients, and I was a patient myself, and I was I had actually, while I was working at Ritz-Carlton, I was hospitalized for 3 months. I had Guillain-Barré syndrome, so I was paralyzed from head to toe. For a long time, I was on a feeding tube. I lost 50 pounds. I was on a ventilator. I came home in a wheelchair, and was about out for the better part of a year. But when the feeding tube came out and I lost all this weight, I needed to eat again, I could not eat the hospital food. This is exactly what I experienced back then. And that was, at this point, 20 years ago. And so to me, this became really personal about improving it and now being in a position where we can actually change that. We were in the 9th percentile on quality of food. We use Press Ganey. Most hospitals in the country use Press Ganey. Not everybody measures food quality through that. They took the question off the survey. That tells you something too. Let's stop asking about it, because hopefully the comments will go away. They will go away if you don't ask about it. And we were the bottom of the barrel. And we also a big food company, right? We serve 10 million meals a year. We have over 1,000 employees that are in food and nutrition, including the dietitians, the food service workers, chefs, et cetera. And our food expense is $55 million. That doesn't count the revenues, the labor costs. So basically, it's a $100 million organization within Northwell Health. That's a big restaurant chain if you think about it. And we didn't have anybody in charge of that. We didn't have anybody run food services for the organization. We had a decentralized model. Every hospital did their own thing. There was a committee. The chefs came together. They discussed things, but we really never moved the bar. So we needed disruptive innovation. We needed to change things to do that. And how we approach that is to bring the right stakeholders to the table. Procurement obviously plays a huge role in it, all the things that we're purchasing. Unfortunately, it's always focused on, from my perspective, at the time it was focused on, let's buy the cheapest thing, or let's buy the things that we get the most rebates on, discounts on from US Food, et cetera. We brought the operators to the table from the hospitals, the chefs, the food and nutrition directors, et cetera, and the patient experience leaders. Employee wellness was going through a journey also to trying to improve the food that we were serving in the cafeterias. And because they were always running into roadblocks, they were not able to change that because it was also unhealthy, processed, all the things that we don't want for our employees. And our clinician partners, our physicians, our nurses. Those were the key groups, but we also brought marketing to the table to help us with internal communications, and et cetera. So a very tight, close-knit collaboration and partnership. And what did it look like? So we had in some places a cook-chill model. We had most of the food was frozen, canned, fried food in the organization. Lots of processed food and laden with preservatives. Most of it was unappealing. It was pre-packaged, pre-cooked food. You couldn't find really kitchen tools that you would find in a restaurant or a hotel kitchen in a hospital because there was not a lot of actual cooking going on at the time. Scissors and can openers probably would have gone a long way. It would have been okay, and then put it in the ovens and heat it back up. Lots of unhealthy ingredients, lots of products with high fructose corn syrups and trans fats, et cetera. And most importantly, there was a lack of leadership and commitment to change that. So we, through the committee, we created an organizational statement around our food transformation journey. It's almost like a manifesto that we put out there. That we got our CEO's buy-in, who then, after several iterations, signed it and said, let's put this out there. So this is where we're going. But we wrote it in a way like it already happened, actually. So Northwell has transformed the way we buy, cook, and serve food throughout our organization to support the healing and well-being of our patients, team members, and community, elevating the taste and quality of foods we serve. Sort of a mission statement. And we were defining what healthy means. We created the healthy choice, similar to what Chef Gary talked about with Disney here. We talked about our responsibility as a health system. When we talk about a health system, we're not a sick care system, or we shouldn't be at least. We have a responsibility to serve better food, to serve healthy food that tastes good for our patients, especially when we go out into the community and talk about all the things we're doing there. We're fighting social determinants of health and the food insecurities within that, trying to help people to eat better and to take care of themselves better. And the role education plays with that. That's why teaching kitchens become such an important role also. Teaching, again, the community, the patients, our own employees, the professionals within that, et cetera. And what was most important, I think, was a focus on chef excellence. But what I found is that we really didn't have the talent in the kitchens that we needed to cook great food for our patients. So we turned to the restaurant and hotel industry. And but not right away. When we created a position to run food services for the organization, I got a lot of resumes from HR. And I looked at them, or I interviewed the people, I brought them in. I'm not excited, next. I'm not excited, next. I'm not excited. Until I was introduced to somebody from the hotel industry who never worked a day in his life in the hospital. I don't think he's ever been hospitalized, actually. He's never stepped foot in the hospital. But he was working for the finest restaurants in France. He's from France. He worked at the Plaza Hotel in New York City for many years, then moved with Fairmont to California. He had a Michelin star at the Sonoma Mission Inn. And when I met with him, I saw passion for food in his eyes. And he was excited about the opportunity to use his skills and his talent to help people that otherwise cannot, or many of them can't even afford his food, probably, that what he was charging in California, trust me, for this amazing food. And it was just a different level of excellence. And I felt I was excited. That could excite the organization, that it could excite the people that work in food services in the organization. So Chef Bruno started, and the media picked up immediately on it, and we were on nightly news, national television, New York Times, in Cranes, in Becker's, in the Wall Street Journal, Inside Editions, et cetera. So we figured, like, maybe we're onto something. If the mainstream media picks up on that, that is exactly the excitement I was hoping to achieve. And then went to work. Truthfully, the work already started. We were probably a year into that, into the journey at that point, to look at, again, looking at all the things we purchased, moving from frozen and canned to everything fresh coming in, having fresh proteins instead of frozen proteins. I think we had 165 chicken SKUs that we purchased that our chefs were able to use. So we created a lockdown list. We said by X date, you won't be able to buy that anymore. Here are the products that you can purchase. So change your menus now, because in 4 months from now, you're not going to be able to do that anymore. But in a very supportive way, Chef Bruno was working with the chefs along the way. We eliminated antibiotics and hormones for all of our proteins. That's why that resonated very well with me. Lisa, it was very hard to do that. It's not easy for sure. More plant-based foods we introduced. We changed the bread program for like a hotel or a restaurant would use. We purchased bread that was probably you could have enough bread for a month or something like that, because it didn't go bad, and they stuck it in the freezer, and it was shrink wrapped and lots of preservatives in it. So we did a test. Chef Bruno put one of the slices on his shelf. Every week we looked at it, no mold growing on it. So I think it was 6 weeks or so until it actually turned bad. Now we worked with some of the bakeries in New York City that supply the restaurants to supply us the bread. You have to change the processes because now you have to order daily and not just monthly anymore. We also worked with local bake shops to make desserts for us that fit the criteria that we identified: under 250 calories, not go over a certain amount of sugar, no trans fats, etc. And there were beautiful little desserts that we went through the process of refining. And Bruno, I remember it very well. It's pretty awesome, actually, when they come for the tastings. And then he said, "No, not good. Come back in 2 weeks. Come back in 2 weeks." Security outside of our door was very happy too, because they brought so many samples. So we gave them the leftovers. So they were always smiling when they came to for the tastings. Culturally diverse food offerings. We live in the most diverse, arguably the most diverse area in the United States. In a hospital where we have a very high Korean population, we introduced a seaweed soup that is typical for a mom that just gave birth, that they eat within their culture. We changed the kosher food because that was a terrible product. All different focus has been given to that. We ripped out all the fryers and had no more fried food in the organization. But our chefs came up with the idea that they had a funeral for the fryers, actually. So there was one last day where they can eat all the fried food they want. And then we had the funeral, threw them in the dumpster, and then the next day there was no fried food anymore. And we in many of our facilities, we actually reduced or eliminated sugar-added beverages. We still have a few where we have a small selections of them, but more and more we're changing those with alternatives. I talked about the focus on chefs. We have chefs now that have followed Chef Bruno. He came with 3 immediately, actually, from the Fairmont Sonoma Mission Inn that followed him to come to New York. I got a cease and desist letter from Fairmont Hotels to stop hiring the chefs because we depleted their talent in the hotel. And every hospital now, with the exception of 1 or 2, they have a new chef. And then that trickles down in the organization. They have other chefs joining from restaurants and hotels. And I truly believe that we have the finest culinary staff now in healthcare. And we worked with HR to do a recruitment trips to the Culinary Institute of America. We're bringing externs in from the CIA, actually developed the program for them, that they don't just have to go to the restaurant industry or hotels. We provide great things for young chefs, actually. We have great benefits. We have a better lifestyle, better hours, and also a higher purpose where somebody wants that, we can offer that to them, but they can also fulfill their creativity and their culinary craft and why they went into this in the first place. Just quickly, this picture that's on the bottom left there, we had a patient experience conference with 600-700 people in the room, and we asked all of our chefs to come up on stage, or not all of them, but most of them, and they got a standing ovation from the entire audience. Many of them physicians, hospital executives, etc. And that was an amazing moment for us. I talked about teaching, so a lot of focus on teaching. Chef Bruno goes to every facility once a quarter, spends an entire day there, writes a report afterwards, and then meets with the executive director, with the CEO of the hospital, to go through the report. So we're getting tremendous buy-in and support from the top. Created a recipe database, uniform standards, eliminated cook chill where we can. We do in-room dining in the big tertiary facilities. We have like a mix. It's still cook serve, but a lot of it is in-room dining is what we call room service. We expect that our chefs round on the patients. They have to get up on the floors, talk to the patients, ask them how the food is, and they have made that their practice. And imagine you're a patient in the bed and the chef walks in and asks you how everything is. So a little bit like a restaurant. We're trying to bring the restaurant experience to the bedside, and then change the menus also to look more like what you would find in the restaurant as well. We have a chef's challenge every year. We just had it 2 weeks ago where the chefs from the hospitals actually are competing. And then it's like an Iron Chef style competition. It's team-based though. Last year we had Lydia Bastianic, who's a very well-known TV chef, as one of the guest judges. This year we had David Burke, who was also, I think, on Top Chef. And then they have an hour and a half to prepare a 3-course meal. And the criteria is that one of those dishes has to be on the hospital menu, and that they have to fit all the nutritional requirements. And the team is made of 3 chefs, and the dietitian is also participating actively in cooking the meal. It is an unbelievably exciting day every year. Michael Dowling, our CEO, was there last year. He was so enamored with it. When we were handing out the prizes, he said, "What are we giving them?" I said, "Here, they are presenting their food to like celebrity chefs, and here they get a glass trophy." A glass trophy? Can we give them something better? So we actually, this year, the winning team is going to Napa Valley for a 4-day trip, all expenses paid. They get to bring a team member, and it's all sponsored by our CEO, because he believes in that mission so wholeheartedly and is so excited about what we're doing around food. Dietitians are an invaluable, obviously, team member, contributed to that, but our dietitians are here to support the chefs. They work hand in hand. They used to design the menus. They used to actually, in many cases, run the kitchen. They've never ran operations like that before. So now they are helping with the things that they are really good at, making sure, most importantly, that we don't do anything that would get us in trouble with a Joint Commission or anything like that. But they are just incredibly creative, also working with the chefs and supporting that effort. Teaching kitchens, we are actually also, we want to build what Boston Medical Center has. We are looking at building a bricks and mortar kitchen as we expand all the other teaching kitchens throughout the organization. So we're going to do a rooftop farm teaching kitchen that's right next to it on top of the roof, and then also have a food pantry to support the communities through that as well. Focus on sustainability, building partnerships with farms. As an organic farm upstate that is going to actually, they're just now growing the produce that will get into our food stream. We've been working with US Food to have the produce come from local farms. There's a farm in Queens, actually, that's 1 mile from one of our hospitals, Long Island Jewish Medical Centers, that is 47 acres in the middle of Queens. I didn't even know it existed. It's the longest operating farm in the United States. It's been operating for 325 years. And it's also a museum now, that now we are working with them on all kinds of things, programming, but also to get the produce from there for some of our hospitals. Here's where we are today. This says we went from the 9th percentile in the first quarter of 2016. We already made some improvements that year because we ended up in the 24th, but now we're at the 84th percentile rank, actually, as of this month in 2023. It is amazing to see how this has improved. That's the average of all the surveys across the organization. Many of our locations are well into the 90th percentile rank. We have a tertiary hospital that's in the 92nd percentile rank, and it's a straight line up. Basically, year over year, we've made improvements. And this is what our patients are saying now. And that's what, in my opinion, this is really about. The numbers are great. That's how we measure progress. But when a patient says that I was so thrilled with everything that I didn't even remember that I was in pain and not feeling well, or that they were looking forward to the choices, that they were staring at the menu all day long, trying to think about what they're going to have for dinner, that took them out of the hospital experience. that being in a hospital is never an enjoyable experience, but your caring meal preparation was the highlight of my stay. And now we're getting bombarded with positive letters that are sent to Michael Dowling. Sometimes they just talk about how incredible the food was. Yeah, the care was great. I survived what I was there for. Doctors were amazing, nurses were great, but the food was extraordinary. And that is really special. One patient even wrote a poem that you see there on the right, and I'm sure we'll share the slides and you can read that poem. But now I'm going to share a video with you to see it in action.
What is it about hospital food? How can we demand the most advanced, curated treatments, but never question the lifeless fare served 3 times a day? Even the school lunch lady would be appalled. Yet here we are, with meals that are more bland than beneficial. But could hospital food be something, I don't know, actually appetizing? So what in the name of green Jell-O happened?
Yeah, that's the question, is why it doesn't have to be. I mean, mostly it's always that it's frozen, it's not fresh, there isn't attention to detail. It's really handled as a second thought.
You traditionally got lots and lots of complaints about food in hospital settings. I know I've received quite a lot over the years about the need to improve.
Hospital administrators have looked at food not as a benefit to the patient. They looked at it purely as a number on the balance sheet, as a cost, really. And we had one leader who said, no, our food is good here at this hospital. I said, well, if you think the food is adequate, how about you eat the food with your leadership team? So they decided to order off the patient menu for 1 week. It was brought to the executive suite and they were eating the food. After day 2, I believe, they got it and they said, we can't eat that.
And that's when things really got interesting.
Prior to 2017, our scores were probably in like the 16th percentile nationally, so they weren't very good. And I could tell you because I was there and the food was not that great.
We needed somebody who was passionate about food, who can be a role model that all of the culinarians within the organization actually look up to, who can teach, and also who can bring in talent that is different from what we're used to in healthcare.
Enter Chef Bruno Tesson, Michelin-starred chef, and the change agent Northwell needed.
After 40 years of being in the hotel restaurant business, I wanted to do something different. All my life, I worked for people who could afford my food, expensive food. Today, I'd like to give back to the community and I'd like to impact people's life.
And as soon as he arrived, everything immediately changed. Well, not exactly.
When Bruno first started, he used to come back from the site visit, so when he spent the day at a hospital, and he said, it's terrible. We have a long way to go.
The chefs were not really passionate or focused on what they were doing, and the food just didn't look very attractive either. There was food from 2012 in our freezers. We were buying pre-cooked frozen hamburgers, pre-cooked frozen fish. The chefs were not really cooking. I think the best tools in the kitchen were a can opener and a pair of scissors.
Most of the food we bought was processed, unhealthy ingredients, high fat, saturated fat. A lot of food was actually fried. We decided to make a big move and to rip out all of our fryers.
We have converted our freezers into refrigerated space. We start cooking with fresh food. We basically have brought the restaurant philosophy to healthcare. I call it farm to your bed instead of farm to table.
It takes a different type of talent to actually prepare fresh food with whole ingredients. It takes a different skill level.
I didn't want to hire a chef who had a healthcare background. I looked at resumes of chefs that work in the hotel restaurant industry, who worked in the best hotels and restaurants in the world or in the United States.
When I sat down with Chef Bruno during the hiring process, I said to him, I would like to do something where I could make a difference, where I could try and change with what I can do. He said that's exactly what we're looking for. We're looking for new chefs to come in with the skills of brand name places and restaurants and hotels, that mentality, and try and bring that philosophy here to Northwell Health.
At the beginning, when I would do my visit in the kitchen, I could see that there was a little bit of hostility. And then a few weeks later, after changing a few things, I could see that the staff was embracing what we were doing.
He kind of watched. He didn't come in, changing everything right away. He went to every hospital, saw what they were doing. What he liked, he had them fix and perfect a little bit. It was definitely nerve-wracking. You start to know him and you start to realize that his only goal is just to make everything better. He just wants the best for the patients, which honestly, if you want to be here, that's what you want.
Where are the rolls coming from?
Those come from Amy's Bakery.
Amy's Bakery. Fantastic. Well, gentlemen, great job. Keep it up. Maybe the next time the sweet potato, make it a nice canal with 2 spoons, instead of just laying out like that. And that's perfect like that. Great job, Stuart. Thank you.
It doesn't have to be terrible. It just doesn't, right? Like, there's no reason why somebody can't cook the same meal in a restaurant or a hotel, wherever you go, right? A stove's a stove, an oven's an oven. Why can you not make the same meal anywhere? There's no reason it can't be done.
Patients are in the hospital, they're sick, they have specialized diets. Being a dietitian myself, it's been really rewarding to be able to have input on what the recipes are going to be, and working with the chefs and finding unique ways to reduce sodium content, maybe reduce sugar content, things like that. The patients all receive a menu when they come in, and that menu is a room service menu. It looks just like a restaurant menu. Pick whatever you want on that menu from 7 a.m. to 7 p.m.
Any patient request, regardless of the diet, we've told all staff members, and everyone knows that it's our mission. Whatever it is, we've got a refrigerator full of food. We can do anything.
In that case, Chef Bill, I'll take the rack of lamb.
I've worked in hotels, country clubs, unlike working at a restaurant where you can just throw butter, cream, and salt to flavor everything. In a hospital, you couldn't do it. So I actually was able to create my own menu, because they wanted to have a real chef and real food made from scratch.
Here at LIJ, we are the largest culinary facility in Northwell. We average around 5,000 patient meals a day. We encompass 4 hospitals. On any given day, we're between 1,200 and 1,400 patients, our census. So we cook it all day, every day, and it's fantastic.
Patients have very little control in the hospital. And if there's something that can brighten their day, give them a smile, share with a family member, that can change a day, that can change an outcome.
I knew it was going to be different when I saw the menu, because it had everything that I was looking for. I really felt like I was in a gourmet restaurant, and that's why I wrote a letter. You feel like the people are there for you, that they care about you. They want your experience to be as good as possible, especially due to the circumstances.
It's very rewarding when you hear the people say that, I feel like I'm in a hotel, because that's what we want.
Very much like in a restaurant, when a table asks for the chef to come out and to thank them how great it was. That's what's happening now. In addition to that, the chefs are actually rounding on the patients as part of their regular routine to check in with them and to get feedback, to see how things are going and what they can do to improve the food, which makes a huge difference also for our patients.
Is that your first meal here, or did you have dinner last night too?
No, I had dinner last night. The lamb chops was cooked perfectly. Well, this hospital here, to be honest with you, and the food here has been phenomenal. This is not hospital food.
We had one letter that said, this is the best salmon burger that I've had in New York City. Anywhere in New York City was the best salmon burger.
And as the meals improved, the patient satisfaction scores for food quickly followed, going from 7th percentile to 75th. And for 7 Northwell hospitals, these scores are in the top 10% nationally. All this while dramatically decreasing food waste and not increasing cost.
It's about changing not only the food, but changing the culture the food and nutrition culture in healthcare. I think that if you're committed and if you put the means behind it, everything is possible.
We're improving the health and the wellness of the people and the communities we serve. The food plays a big role in it, and that makes me happy.
Food is health. It's important. It's been one of those things that we've done that has made us distinctive, and we should be very, very proud indeed.
So, what are we to think about this incredible journey to improve the hospital food experience? What we learned is that it's not just about improving the quality of food. It goes much further. Food actually helps people heal, and that's what it's all about.
Come in. Hello, Chef.
How are you?
I'm great, thank you.
I'm
Bruno. Hi, your team is phenomenal. Been to the Plaza. Your French toast, as good as the Plaza. Your pot roast, everything. The cheesecake. This is the best hospital. I don't mind being in the hospital this time. I just can't get over how wonderful everything has been.
Thank you. You have my name and number on there if you have any issues.
No, I'll call you Saturday night when I want dinner.
I love that patient. It was not scripted, and the funny thing was that she did not know that Chef Bruno actually worked at the Plaza Hotel, and she made the comment about the Plaza, which was really, really fascinating. I'm going to skip over that real quick. I know we're tight on time, but now some of the things that are happening. We actually had the Washington Post come in January and spend 2.5 days with us, a food writer from the Washington Post. We put him in a bed, let him order off the menu, and then that's the food that he critiqued, but we took him to 2 of our hospitals. Dr. Harlan was also interviewed actually for that article. It was an entire spread. Chef Bruno made People magazine right after William and Kate, which he couldn't believe that story about him, and that it's not on here yet because it just happened last week. We were in the Wall Street Journal as part of a patient experience article, and the picture was from our chef's challenge. And the writer said, out of all the stories I heard, the food is the most interesting one, elevating hospital food. And in the next few weeks, The Dish is going to have us on national television. They came and filmed in January. I guess it takes a while until they get the stuff out. So we're very proud of it, but who's most proud of it are the people that are working in the kitchens, actually, because it's a validation for the hard work that they are doing, and the dietitians, et cetera. Just a few things. What's next? We're not stopping. We're continuing to go up. I mentioned a lot of those things, actually, already as I'm looking through that. So I know we're tight on time. I want to make one more point, and that is, I know you're probably thinking here, yeah, they must have a lot of money at Northwell Health to be able to do that, right? Well, guess what? We just made a few key investments. The food cost went up by about 2% year over year, just what we would normally see with inflation, because we've cut out a lot of waste by buying fresh products and having the right talent. That is actually a lot more effective than some of the talent we had there before. Chef Bruno used to say, why do we need 20 people to plate up this? If I bring 5 people from the restaurant, they can do the same work. And so there's a lot more, through the passion, through the focus on excellence. We didn't hire any more FTEs than we had before. If anything, less now, because we have a lot of open positions always, because it's really hard to find people in this environment. And as I said, we found a lot of savings and put a lot of pressure on our food suppliers. Scale helps. Being a big health system helps, and demanding the best prices for that. And they're looking at also as an opportunity to enter the healthcare market, and having a market that they were not able to break into previously. So the net new investment really was hiring Chef Bruno, which we would have had to do anyway to create a position for that. And that's my presentation, so thank you.